Imagine this. It's 2 a.m. You're lying awake, overwhelmed, and your thoughts won't stop racing. You know you need to talk to someone, but your therapist isn't available, and you don't want to burden your friends. So you turn to an AI chatbot. Within seconds, it responds, detecting patterns in your speech to offer words of comfort and provide practical coping strategies. But can an AI therapist really understand you like a human therapist can? Artificial intelligence is transforming therapy, providing mental health support through chatbots and virtual assistants. These tools use natural language processing and machine learning to generate responses based on cognitive behavioral therapy. Apps like Woba and Wysa offer daily check-ins for anxiety and stress management, while Replica provides emotional support. More advanced systems like ChatGPT or Google's MedPalm are being explored for deeper applications. While AI offers immediate, low-cost, and stigma-free support, it doesn't replace human therapists. It serves as a supplement to traditional care. To gain some further insight, we interviewed an expert in the field of social work to get their opinion on the field. Disclaimer, the opinions expressed in this video are of our expert and only our expert and do not reflect the opinion of their peers or employer. Okay, hello there. So before we start, maybe you could tell us your name and a little bit more about yourself.
Perfect. My name's Ruth Greenspan. I'm a social worker. I have my master's of social work, which I received in 1988. So I've been at this quite a while. And what I do is I do counseling in a private practice. I also do some contract work at probation at a school board, and I also teach in the social work area as well.
Have you ever seen AI tools like a chatbot or mental health apps make a real difference for clients?
Absolutely. I use and refer most of my clients to the mental health apps, and it's there 24/7 when I'm not. It gives them that independence and it gives them resource and support so that they don't feel that they're all alone at times when they're having a really difficult time. Also, in intimate partner violence, which I do a lot of work in, people need resources quick. They need to get facts quick. They need to know what's available. And AI is pretty good in those aspects, and I've used it in that way as well.
Do you think that AI will become a standard part of mental health care within the next 5 to 10 years?
What I would like to see is always having choice available. And I say that because, as mentioned, I did not believe that once COVID came, that my clients would want to see me in Zoom, that they would ever get used to that. And they did. Some loved it. It's added flexibility. It's added a more personal situation for some. I don't think we can demand everybody use AI or everybody not use AI. But if it becomes a tool in the toolbox that helps us meet patients and clients where they're at, I think that's the best way we can go. And we may develop, and they may develop new technology that we don't now have. So I don't want to throw out something that is a art that moves so quickly that I don't know. My only piece is I don't ever want to replace the personal connection between individuals and therapists, individual therapists, families, because building that rapport and having that therapeutic alliance is, I think, one of the most important things we do.
Do you think AI can effectively be integrated into therapy, or does it risk replacing critical human interaction?
I think it can be integrated in many of the areas because therapy and social work is not just sitting in chairs talking to one another and we're done. There's the pre-work, there is the research after, there is diagnosis and assessment. All of those, I believe AI has a really important role. I do not ever want to replace the personal therapeutic human to human contact. And that would be something that I would be very skeptical if we were looking at replacing in 5 to 10 years. Enhancing for sure, adding more, yes. But I don't think AI will ever be able to build the trust, the empathy, the compassion And all of those pieces then go towards your therapeutic alliance and support to a client. I don't think those pieces should be replaced.
A huge thank you to Ruth Greenspan for sharing their insights on AI in therapy. Looking at some published studies now, starting with a cross-sectional study published in February 2025 by Hatch et al. In PLOS Mental Health. In the study, participants were asked to distinguish AI-generated responses from those written by licensed therapists. They identified therapists correctly 56.1% of the time and AI-generated responses 51.2% of the time, almost like guessing. But here's the twist. AI responses were rated higher on key therapy factors, scoring 27.72, while therapists scored 26.12. AI-generated responses were also longer, more detailed, and had a more positive tone. This suggests AI could play a role in therapy, but while it may assist, it can't replace the human touch. Moving on to another study by Kuhel et al. In February 2024 comparing human-human therapy with human AI therapy, in which the results were surprising. AI-assisted therapy sessions were rated slightly higher, scoring 3.70 out of 5 compared to 3.43 for human-only sessions. Even therapists had trouble telling the difference. When asked to identify whether a session was human-only or AI-assisted, they were only correct 53.9% of the time, barely better than guessing. The takeaway? AI can be a valuable tool in therapy, improving accessibility and support, but again, the human connection was not tested. AI therapy is making mental health care more accessible than ever. Let's look at the key benefits. First, AI therapy is available 24/7, providing instant support anytime, even outside traditional therapy hours. Second, it's affordable. Many AI mental health apps offer free or low-cost alternatives to traditional therapy. Third, AI reduces stigma by offering a private, anonymous space for users to express their thoughts. And finally, AI can scale mental health care, reaching millions who might not otherwise have access to support. AI therapy has clear benefits, but its limitations can't be ignored. One major concern is its lack of deep emotional intelligence. AI can mimic empathy but doesn't truly understand emotions. There's also the risk of misdiagnosis. AI can offer general advice, but might not recognize when urgent help is needed. Privacy is another issue as AI therapy tools collect sensitive mental health data, raising security concerns. Most importantly, AI lacks real human connection. Therapy is about trust and intuition, something AI can't fully replicate. So while AI expands access to mental health support, it still has major gaps. So, can AI replace your therapist? Based on what we discussed in this video, not quite yet. While AI can make mental health support more accessible, affordable, and immediate, it still lacks the deep emotional intelligence, ethical safeguards, and human connection that traditional therapy provides. Right now, AI works best as a supplement, not a substitute, something that can provide support between sessions, but not fully replace the role of a trained professional. But what do you think? Would you trust AI as your therapist, or do you believe human connection is irreplaceable? Let us know in the comments below.